Hi there, I'm Dr. Andrew Biondo, and on behalf of Excel Specialty Contacts, we'd like to introduce the Rapid Eye Molding Lens, or REMLens, orthokeratology device for the correction of myopia. Very excited. This has been a long time coming, and a lot of research and development has gone into this design. It really offers the complete package in an orthokeratology system. It combines reliable empirical outcomes, so no need for a large investment in a fitting or dispensing set. It's fully customizable as far as modifications go and very easy to modify. And it's backed by a lab that always stands behind its products with practice family pricing, warranty policies that are easy and very agreeable to the practice and the patient. When fitting this lens, there are 4 zones that have to be taken into account. Fitting again is done empirically through a calculator. We'll discuss that in a minute. That requires at minimum Ks, Rx, and ideally HVID. The lens itself starts with the treatment zone in the center, moves out to the reservoir zone, the stabilization zone, and finally ends with the dynamic edge profile, which is a very exciting advancement in the orthokeratology space for a number of different reasons. So starting with the treatment zone, this is used to correct the apical K curvature, flatten that to correct myopia, obviously. It's calculated to be flatter than that central corneal radius, incorporating that Jessen factor, allowing for regression throughout the day. This provides that positive pressure, that compression, in order to flatten central cornea and achieve the correction of myopia to free patients from daytime contacts and glasses in the majority of cases. Unlike a traditional base curve on a standard GP lens, this base curve is not used as a function of the fit. This is strictly used to control or alleviate myopia by flattening the central cornea. Later curves we'll talk about in a moment here will be utilized to fit the lens to the eye for centration and stabilization purposes. The optic zone of the REM lens can be adjusted from 5.4 to 6.4 millimeters in 0.2 millimeter steps. And there's a lot of reasons why you might want to change that optic zone diameter. Patients who are experiencing flare, glare, and halos may benefit from a larger optic zone. Now, we do know that if young people who tend to be less bothered by things like halos do experience them, we can reassure them that indicates that we are getting that peripheral defocus that we want to see in order to achieve myopia control effect through an orthokeratology system. Adults who utilize orthokeratology strictly for the treatment of myopia might not find these side effects as advantageous, and therefore using a larger optic zone can not only alleviate some of those, it can also actually utilize some negative spherical aberration in order to effectively offer at least some degree of add power and alleviate presbyopia symptoms in orthokeratology patients in some cases. For younger patients, like we just talked about, smaller treatment zones give us that positive spherical aberration, that positive asphericity that allows for peripheral defocus, that tricks that peripheral retina into stopping its growth of its axial length. So obviously with younger patients, especially ones who are looking to control myopia in smaller treatment zones, can be advantageous. We can also utilize this for changes or differences in patient pupil diameters. So patients with large pupils, what might need to utilize larger optic zone diameters in order to alleviate symptoms of that aberration, and vice versa for myopia control patients with smaller pupils. The reservoir zone serves a very important purpose in creating that negative pressure to draw out epithelial cells or cytoplasm from the central epithelial cells to allow more effective central flattening in that reverse zone there. When we see this on fluorescein, we expect it to be 1 millimeter in radius, and usually it'll be 3 to 5 diopters steeper than the back optic zone radius. This can be adjusted independently, but it's often adjusted based on central base curve and also on the optic zone size. The smaller optic zone sizes can indicate a need for a deeper reservoir zone because the smaller optic zone size will have to flatten central cornea more. This is, again, very effective in myopia control and can allow for more spherical aberration and more peripheral defocus in treatment, especially maybe in children who don't have a whole lot of myopia and therefore won't need a lot of central flattening. This can increase the amount of myopia control that we see in these patients. Finally, we get to the stabilization zone. This is the zone that obviously helps us center the lens. This is what actually contacts the cornea in the mid-periphery and rides on that cornea to make sure the lens stays in place overnight to center our treatment zones and allow proper correction of the myopia. This is fit slightly flatter than flat K based on eccentricity values or shape factor. The calculator will assume a standard 0.5 E value, but this can be adjusted. Obviously, we need shallower or flatter curves in this region, assuming we have a higher level of eccentricity, and vice versa for lower levels of eccentricity where the mid-peripheral cornea will be steeper than expected. These can be adjusted, and we'll talk about exactly how much here in a minute, but you can adjust the sagittal height to shallow or deepen this zone very, very specifically in 0.1 micron steps with the help of a consultant. Finally, we get to the edge, and this is something very unique to the REMLens design, the dynamic edge profile zone. This zone can be moved steeper or flatter. It's actually based on the central base curve treatment radius. And so utilizing that, we know exactly how much edge lift we need in that mid-periphery. Obviously, edge lift has to be present in order to create kind of a proper seal in that stabilization zone. But by knowing what we are doing centrally, we can more appropriately lift that edge as to not cause unnecessary awareness of that lens for patients, especially new wearers in orthokeratology devices. While rarely do we lose patients to discomfort, it can be a headache for fitters, for parents, and for patients who have to deal with the adaptation of a rigid lens, especially in some children who might be more sensitive to foreign bodies in their eyes who have never worn contacts before. So not only utilizing an edge that more specifically fits the individual cornea, but also then being able to manipulate that edge steeper or flatter to make sure you have enough edge lift without being excessive can speed up the adaptation process for these children or adults who are new to contact lenses and new to rigid lens materials. All of the zones we talked about, from the stabilization zone, the reservoir zone, dynamic edge profile zone, can be moved independently. All of them are based on the initial parameters that you input into the lens calculator system, but any one of them can be moved independently in order to maximize fitting efficiencies if any imperfections are seen either in the fluorescein pattern observed upon dispensing or in the topographies at the 1-day or subsequent follow-ups when patients return to your office. The REMLens obviously does offer toric designs, starting in the reservoir zone and obviously carrying out from there as a function of sagittal height differences within those zones. This is recommended for patients who have more limbus to limbus astigmatism with the rule greater than a diopter. Greater than a diopter of against the rule astigmatism, especially limbus to limbus, typically indicates a poor candidate for orthokeratology. This can also be utilized if you notice asymmetric fluorescein patterns within that reservoir zone green band. That can indicate a need for toric fitting. And then finally, on your topography, using The elevation difference maps, if you notice 30 microns or more between the steep and flat meridians in the mid-periphery of the cornea, that can be a good indicator for the need for toric designs. Also, anybody who shows some toricity and then subsequently has difficulty with centration, so you see them back at day one, they're nasally decentered, see them back a week later, maybe a little temporally decentered, you know that lens is shifting, you know there's some astigmatism there, it's usually worth trying to incorporate a toric design in order to try to better stabilize the lens and central compression of the cornea. So ordering the lens is extremely simple. Like I said, at minimum, K values, refraction, and HVID are recommended. Really all that you have to input are K values and the refraction. HVID is helpful in determining lens diameter, as we'll talk about here in a moment, but is not completely necessary. Pupil diameter, eccentricity can also be incorporated in order to maximize first fit success with empirical ordering. This calculator not only will give you the parameters of the lens to be ordered, you can also go ahead and order the lens electronically straight through the website without the need to phone Excel directly. So again, there are a wide array of options when it comes to fitting the REM lens, and diameter is no exception. There are 5 different diameter options that you can choose from for the REM lens design. Ideally, 10.6 will be a standard diameter for most patients, assuming a visible iris diameter within the normal range of 11.3 to 12.3 millimeters. Smaller iris diameters or smaller visible iris diameters, say 11.2 and smaller, might recommend starting in a 10 millimeter design. And for those big corneas, 12.4 millimeters or larger, it helps to jump to the 11.2 millimeter design. If you're not sure, again, fitting consultants will always be on hand to help you try to decide the best initial lens parameters for your patient. So the REM lens is available in the Boston Equilens 2 material, currently the only one approved for overnight wear in orthokeratology. It has a very wide selection of base curves available, and again, like we just talked about, 5 diameter options, moving from 10.0 up to 11.2 millimeters. Optic zones, as we mentioned earlier, can be adjusted 5.4 to 6.4 millimeters in 0.2 millimeter steps, and it's approved to correct up to 5 diopters of myopia. The treatment zone or base curve can be moved in 0.1 diopter, or excuse me, millimeter steps. The reservoir zone, this is a function of sag, can be moved up or down in 10 micron steps from the initial recommended reservoir zone parameter. And stabilization zone can also be increased or decreased, again, usually based on either the fit, fluorescein pattern, or it can be changed initially based on eccentricity or shape factor values. Dynamic edge profile, as we mentioned earlier, can also be steepened or flattened to give an increase or decrease sag to improve comfort and guarantee edge lift. The toric options, the initial toric offering will be a 30 micron sag difference in toricity. You can increase that then in 10 micron steps if you read otherwise on your topographer. Each REM lens will be laser marked for easy identification. So this will allow you to not only identify the lens and match it to, say, an invoice, but you can obviously not even have an invoice and know the exact parameters of that lens design. So on the top line, it'll give you the base curve or treatment zone. The next line will give you the sag for both the reservoir zone and stabilization zone. The dynamic edge profile, then even the toric factor, if you include toricity in your lens, will be laser marked on each and every REM lens design that is released. So in conclusion, like we talked about, very reliable empirical outcomes, easy to input data, easy to manipulate even before you order that first lens. If you like to look at things like visible iris diameter, eccentricity values, toricity, etc. Fully customizable modifications with independent zone manipulation availability, And then again, like we mentioned earlier, as Excel always comes through with, very practice-friendly pricing and warranty policies. If you're interested in the REMLens design, and I hope that you are, please reach out to Excel. It should be launching when you're listening to this at Vision by Design. You can call them or you can visit their website for more information, and hope to see you all very, very soon.